All right, hello everyone. Welcome to our latest Queen Elizabeth Scholarship webinar. We are joining you today from the McMaster Health Forum at McMaster University in Hamilton, Ontario. It's a short agenda for what we're going to be covering today. I'm going to tell you a little bit about the McMaster Health Forum, a little bit about the Queen Elizabeth Scholarship Program, and then we're going to turn it over to our guest speaker for today, who is Peter Malik. So the McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We aim to harness information, convene stakeholders, prepare action-oriented leaders, and to be an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rito Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the Forum, the Queen Elizabeth Scholarship Program is entitled Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. Here is a list of our first cohort of scholars. We have a combination of incoming scholars, outgoing scholars, and outgoing interns. And here is a group of our second cohort. As you see, we have much more outgoing scholars the second time around. Our presentation today is from our first cohort of scholars, Peter Malik, who is an intern. He was an undergraduate student in the Bachelor of Health Sciences program specializing in global health. His current research interests involve improving health outcomes and access to equitable health care, along with exploring ways in which evidence can be most effectively utilized to inform best practices. Peter interned with Malawi's Knowledge Translation Platform, or KTPMalawi, a partnership created by the Malawian Ministry of Health and Dignitas International to translate research into contextualized, evidence-based health policy. So, without any other introduction required, I'll just turn it over to you, Peter.
Thank you, James, for that very kind introduction. And hi, everyone. My name is Peter Malik. I'm happy to share with you my experiences with the KTP Malawi project. Thank you for joining us today. So a quick overview of the presentation today. I'm going to go over how I found my placement, which was in Zomba, Malawi. I'm also going to be going over what I prepared for my placement, just for those who may be interested in applying to the QES scholarship, as well as a little bit of background information about Dignitas International, which is one of the partnering organizations that formed Knowledge Translation Platform Malawi. They are also my host organization, so I'll go into a little bit of background about them. I also want to cover some of the projects I was involved in while I was working with KTP Malawi, and finally some lessons learned. So this is Malawi. As you see the green country here. It may look small, but it actually has a population of 18.5 million people as of 2016, and that's just about half the population of Canada, actually. And just to give you a little bit more context to the demographic I was with there, almost 50% of the population is actually under the age of 14 years. Something interesting I found when I was doing research for this presentation was that on the CIA World Factbook website for Malawi, they actually disclaim that the population of the country is heavily impacted by the prevalence of HIV. And so I thought that was some relevant information because the nature of my work with KTP Malawi was dealing with this key population. And so I was fortunate in that the official language of the country was English, and I didn't have to learn any other language to be able to work there, although there are other cultural languages such as Chichewa, which I was, again, lucky that I didn't have to really pick up to be able to work there. There is an overlay of a map here of the country, and I've included some relevant cities that I visited frequently. Zomba was where the headquarters were, so that's where I stayed and worked, but the type of work I was doing required me to actually travel to these cities quite frequently, actually, so it was a good way for me to explore parts of the country. Lilongwe is the capital, and I also visited Blantyre quite a few times. I included Lake Malawi there. Lake Malawi was a beautiful part of the country that I like to visit as much as I could. It's a very large body of water. I think it's the 9th largest body of water in the world. whereas if you can compare it to something closer to home, Lake Ontario, I think, is the 14th largest. And it's a very large source of income for the country with a lot of government and privately owned fisheries. And it is also some of the best seafood I've ever had there. So if you're interested in doing a QES scholarship and really like seafood, Malawi is definitely a place for you to consider. And on that topic, why did I choose Malawi as my destination? So there's a few reasons for this. I had previous interest in HIV and AIDS management in sub-Saharan Africa, and this was informed by some volunteer work I did in Kenya in the past. And in addition to that, with more exposure to the work of the McMaster Health Forum and through some of the coursework in my bachelor's program, I became more familiar with knowledge translation strategies, and I knew that whatever my placement was, I wanted to have I wanted it to be based on these sorts of things. And so KTP Malawi was actually a really nice fit that kind of merged my interests, as well as somewhere I'd never been before. So I knew I was going to be taking, a big leap out of my comfort zone and doing something new and really have a chance to gain some independence, which I was also really looking forward to. Aside from that, I was also involved with the Dignitas Youth McMaster, which is the student chapter for Dignitas International here at McMaster. And so this would put me in a unique position to be able to see the operational workings of an NGO, of an organization that I was also previously fundraising for and raising awareness for. So it really gave me the chance to see the impact of their works on the ground, which was very enriching for me. So I was lucky in that that KTP Malawi was accepting a student to be able to help develop their program, and so I had actually ranked them as my first preference when I applied to the QES scholarship, and I applied in the summer of 2016 for a placement in the fall. And so then I spent September through December there, and as a fourth-year undergraduate student in the Bachelor of Health Sciences program, and because I was specialized in global health, I was actually able to use this QES placement as a way to further my education in global health, as one of the requirements is to do sort of a practicum project. So I was actually able to continue my studies while abroad. I also received, and I'm very grateful for the support I received from the McMaster Health Forum, and not just administratively with things like helping me receive my visa and booking accommodations and everything like that, but also helping me with trainings and that were really pertinent to the work I'd be doing abroad. So letting me sit in on their deliberative dialogues and really getting to see how those run, and also learning how to develop their policy briefs using their methods. This is the slide about Dignitas International. I wanted to give a little bit of background information about this organization because it was very pertinent to the work that I was doing on my placement. So Dignitas International is a medical and research focused NGO based in Malawi, and they started in 2004 by a group of health experts who were dedicated to improving the quality of life of those affected by HIV and AIDS, and they have had a considerable impact on the country since this time, where they've expanded from one main clinic in Zamba to over 150 different HIV clinics throughout the country, and through this they've provided life-saving medications to over 270,000 people in the country. So this represents a significant portion of the population. And as you can see here on the map, you can actually see different clinics that are operated by Dignitas and the different studies that they're under. So aside from these studies that you see there, I wanted to also include this slide to show you a breadth of the type of research work that they do, because they really focus on anything from child health to Aboriginal health, and have a large focus on being able to translate lessons learned in strengthening healthcare systems. So as you can see here, they provide health services or HIV services at the Zamba Central Prison, They also help carry out Option B+, which is the national protocol for mother-to-child transmission of HIV in the country. They also recruited expert clients, which are people who are positively identified with HIV who assist at HIV clinics and help take some burden off of the workload of other workers at the HIV clinics by also empowering and encouraging those who are HIV positive. And I wanted to include the work that they've done with the Community Health Worker Pilot Program, because this really goes to show that their work does expand beyond Malawi, and that they are doing research actually in Northern Ontario, looking at a population of an Aboriginal community, and they piloted this program to help strengthen a community of community health workers that can help manage and prevent diabetes, which is a prevailing issue in this population. So then that brings me to KTP Malawi, which is Knowledge Translation Platform Malawi, and this is really what I spent most of my time engaged with during my time there. So as we mentioned, it's a joint partnership between Dignitas International and the Malawi Ministry of Health. And it's in a similar vein to a lot of these knowledge translation platforms that started as far as 2005 with the formation of these EVIP nets, which are evidence-informed policy networks, and the WHO collaborating groups. So KTP Malawi aims to join this group of platforms that help you inject research evidence into the policy decision-making arena, and the purpose is to engage national-level stakeholders, policymakers, researchers, and implementers in a coordinated approach in generating and utilizing health systems research. So their other goals are to help refine a national agenda for health research, and to then create future programming policies that are context dependent and also consider costs. So I included here a definition of knowledge translation for those that might be less familiar. It's definitely not an exhaustive definition, but this is the working definition that KTP we used there. So it's a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Malawians, to provide more effective health services and products, and to strengthen the healthcare system. This was adapted from the CIHR. So a little bit on the structure of KTP Malawi. So we've mentioned that it's formed by these two entities, and the initial discussions for KTP Malawi started in around 2012, where their main focus was really to align the national goals for health research. And how they did this was by gathering multinational, multiple stakeholders from different backgrounds, academic and professional backgrounds. And what they did was also included civil society groups and met to rank specific interests for the country in terms of what health research should be targeting and what are the prevailing health issues in the country. So they did this by looking at three things. They ranked what available evidence there was for specific health issues, the availability of policymakers and willing to collaborate in the specific fields, as well as the availability of content experts within the country that could really help be champions of these issues. So they formed out of these groups that they formed, they called them communities of practice, and these communities of practice were very specialized areas of that all focused on one content area. So there were multiple communities of practice, and each community of practice would be about a different healthcare issue. So my job was really to then help these communities of practice while I was there and help them develop their policy briefs and also help build capacity in these groups. I forgot to mention that these community practices would go on to receive workshops from international knowledge translation managers, And the workshops were to train these individuals to find research evidence, to be able to assess qualities from research studies, also to be able to read and interpret systematic reviews, and finally to develop policy briefs. So this slide is about the projects that I was involved with. So as I mentioned, I was helping produce 4 different policy briefs with 4 different communities of practice while I was there. I was also interested in understanding what makes a successful writing meeting. So each community of practice would meet to really work on these policy briefs, and I was interested in what were the factors that would lead to a successful meeting. I was also, my final project I would be mentioning is conducting an initial feasibility study for developing a rapid response service in Malawi. So I'll be going over all of those 3 projects now. So the first project, developing research policy, as I mentioned, this was my main sort of project while I was there, and how it would work is we would poll availabilities of different members of the community of practice, and we would get them at 2 or 3 days at a time to meet at a city outside of where they usually work, and really just work on developing these policy briefs that all addressed very different issues. So I was involved in writing policy briefs for these following 4 issues. So improving the screening and treatment of hypertension in people living with HIV in Malawi. The second was improving retention in ART care of pregnant and breastfeeding women in Malawi. The third was reducing the burden of malaria in children under 5. And the last was contraceptive use in Malawi in adolescents. So I guess I should note that all of these briefs are at different stages in development. So some of them have been finished and have already had their policy dialogue discussing the brief. Some of the briefs are still being finished, and some of them are just being finished now, and we'll be having a policy dialogue in the coming months. So on your left here, you can see the completed version of one of our briefs that I was working on. This one in particular was integrating non-communicable disease care for those living with HIV in Malawi. And I wanted to include this brief in particular because the findings from the brief were quite interesting, and through the completion of the brief, the authors found that there was very limited global evidence to support one way or another how to treat hypertension in this population. However, there was some local evidence, namely 4 different organizations in Malawi that were running 4 completely different programs for dealing with hypertension in HIV patients. So they took this brief to a policy dialogue and brought members from each of those 4 different institutions and talked and discussed about the 4 different programs. And they decided to actually set a standard set of parameters that they would measure prospectively to be able to compare the different models to see what outcomes are, which program is attaining these outcomes that may benefit the Malawian population the best. So, and from that point, they'd be able to see what combination, if any, of these programs that they could implement across the country. So that was very educational for me to get to see takeaways from a policy brief and then translating into future policy decisions. These findings and conclusions were also reported on a poster that I helped create, and that was presented at the National AIDS Commission, which is an annual conference held in Malawi. So the policy brief on the left here was recently accepted into the Malawi Medical Journal and should be published there in the coming months. So the next project that I worked on was assessing the barriers and facilitators to writing briefs for policy. And again, I was mainly just interested in what are the important factors that we should consider in carrying out these writing sessions. And so we collected formal feedback from the community of practice following every meeting with hopes to be able to improve after every meeting or just to receive any feedback on things that we could change. And the following factors emerged as important for the implementation of a writing session. We found that because we brought together such diverse groups of people within a community of practice, that commonly there were competing commitments of these individuals, and that they would frequently be kind of pulled into their other commitments as they were, tasked with writing their policy brief. So they actually recommended to us as a suggestion to hold meetings outside of where their work is usually posted. And that way it's a little bit harder, or I guess they were able to commit to the writing sessions a little bit better that way. Also, something that came up as significant was to make sure that there was reliable telecommunications for completing the briefs, which could be a challenge in Malawi, considering we did have blackouts and they're not really predictable when they happen, and this could really slow down the momentum of writing a policy brief. Something that was also mentioned as important was being able to discuss the brief and the progress of the brief while they're together, to be able to bounce off ideas off one another and to share their expertise. So the final project I'll be speaking to you about today was evaluating the feasibility of a rapid response service in Malawi. This rapid response service under KTPMalawi would be a new initiative whose goal is to support decision makers by finding and synthesizing available research evidence over a short period of time. So the products that are produced through this rapid response service ideally would be optimally packaged and context dependent and have a really short turnaround time in comparison to the policy briefs that we were working on. So from anywhere between a week to 30 days or even more would be the main target for this type of product. And because the rapid response units aren't very new idea. There has been some units that are already established, and I wanted to understand the current states of knowledge surrounding the best practices and any lessons that could be taken away from the development of those response services already in place. So that when KTPMalawi was developing their service, they could learn from any lessons previously learned. As well, I conducted key informant interviews with members of KTPMalawi to gauge what their interests in the rapid response service would be and what uses that the rapid response service could fill in the current environment. As well as that, I also produced a toolkit with different databases and tools that could be used to actually produce a rapid response product. So this is a proposed rapid response cycle that I've seen the McMaster Health Forum use. And it starts with the requester that has a question to a health systems issue. And what they do is then meet with the rapid response unit to really refine and figure out whether this question is in the scope of what the rapid response service is supposed to answer. And from that point, if it is within the scope, they would search in predefined databases, depending on the type of data that they're looking for, review the search results and assess them for scientific rigor, synthesize them in a way that is convenient for the requester, and pass it back to them for their comments and feedback. So those are for the projects that I was really working on in Malawi, and some of the lessons I learned while I was there was that I think the biggest thing that the importance of collaboration in this field of work, in this environment. I was really impressed with how much collaboration kind of permeated all these different areas of my time there. For example, having all of these different stakeholders with different expertise coming together to help write these briefs. We had people from epidemiological backgrounds, infectious disease, clinical researchers, and clinicians, with policymakers as well, all coming together with diverse backgrounds to really produce something that could be applicable to the Malawi population. And similarly, but on a different note, getting to see the organizational structure of Dignitas International as a host organization and see them as a functioning NGO with different departments that are all responsible for different things but function on a very high level that makes them able to function at a very efficient rate and to increase their impact that they have. I also was very fortunate to get to see research as a process that was cyclical and iterative. And this was a very big educational experience for me that helped me appreciate the use of knowledge translation in this type of field, and getting to see takeaways from a research project, and then having that research inform the next questions, and then collecting data on those questions, and then passing that back to hopefully formulating a concrete answer to a health problem was very enriching for me, and something that I hope to carry home with me as well. And then I also, something that my supervisor really showed me while I was there, Josh Berman from KTPMalawi, that it's very important to not only have experts in certain content areas that can really help with consultations and being able to really be expert in that area, but also have that balance with process experts. And he described this as being able to facilitate and really drive the process of knowledge translation to really marry these two areas and to be able to have the best outcome. So that's for the lessons I learned. And here are some pictures from my time there. On the left, you can see this is a policy dialogue that we held in September. And on the right, you can see me with one of the community practice members. And this is what a typical writing session would look like at the bottom right there. And as you might be able to tell, I was working with these individuals quite a bit. So 2 to 3 times at a time, and then multiple meetings. So it was a really good way for me to learn more about these individuals and get to know them and interact with people from a different culture, which was something I was really appreciative of. This top picture here is where the Dignitas International headquarters was in Zomba. So on the right of that picture, you can see the offices. And above, you can actually see the Zomba Plateau, which was a mountain there that I got to climb. At the bottom left, you can see the Zomba Central Hospital. That's where the Dignitas has the Tisangani Clinic, and they also have their research center there. So I went there a few times, and also held there was some clinic meetings that was held there. And on the right, you can see the street that I would walk down to and from work every day to my accommodation. So something interesting that I found about Malawi was that it's actually common to work 6 days a week. I was fortunate that I had a 2-day weekend, and Dignitas International works 5 days. So during that time off, I would be able to explore the country. And so I tried to get out and see as much as I could. So there's a picture of me there at Lake Malawi kayaking. And you can see at the bottom right, there's actually a lot of cichlid fish, which something about Lake Malawi, it has the largest population of these fish, and they're aquarium fish, so they're very popular to collect for the variety of colors that they have. And then the top right, you can see me at the top of Zomba Mountain. And I also got to see some wildlife there and visit some national parks. So that concludes my presentation. Thank you very much for listening and taking the time to listen to me today. I'm happy to take any questions now.
For that was excellent. What I'm going to ask is if those of you that are in the room, if you have a question, put up your hand and I will have you ask it, and I'll repeat it online. For those online, and those who are online, I'm going to ask you please type your questions in the chat box. With that said, Peter, I'll ask the first question while everybody is thinking. So I was intrigued by the structure of KTP Malawi as a a joint venture between Dignitas International and the ministry, the government in Malawi. So I'm curious about how involved was the ministry as you saw it. So you were further downstream, as it were, in the communities practice section, writing the briefs. So were government officials involved at that step, or was the government more, well, these are the areas that we want you to focus on, or the communities of practice we want work done on, and we'll leave it to you to decide. So just curious how involved the government was and how it impacted your work.
That's a great question. Thanks, James. So from my interactions with the communities of practice, I would often interact with a member of the Ministry of Health. There was a dedicated knowledge translation manager that was working with us there during the writing session. So they were just as involved in the writing process and the collaborative process of these writing sessions. And further upstream as well, there were a senior staff also stationed in KTP Malawi that were present more frequently for things like policy dialogues and other workshops and things like that. But during the formation of the communities of practice, the ministry definitely did have sort of input into what were the priority areas for Malawi to focus on. But it was also balanced with factors like what were the content experts, what areas were they in, and as well what is the research evidence saying about these certain areas as well.
Wonderful, thank you. So I'll look around the room. We have a question from someone in the room. So go ahead, ask the question, and I'll repeat it for those online. So it ended up being 3 questions for those of you online. So I'll see if I can remember them. Please correct me if I get them wrong. So the first question, or the first part of the question, has to do with the processes in using evidence-based for policymaking. How are those in government and in policymaking positions? How are they in, the buy-in to the process, and what they, whether they accept that kind of perspective. The second one is, I'm blanking on it. I'll come back to it in a second. The third one was has to do with challenges in creating these briefs. So you mentioned issues with telecommunications and other types of internet-related things. So a lot of the information you have to use for evidence briefs are found on the internet. So there'd be challenges in accessing that information. So how did that impact your writing of the briefs? Right. So the second part of the question was, how are they ready basically to use the evidence, and are they built to use the evidence, and can they implement the evidence now? So 3-pronged question. I'll let you answer them in whatever order you want.
Okay. So thank you very much for your questions. Regarding the first question, whether the Ministry of Health and the government is receptive to knowledge translation and using research evidence in policy decision making. I think there is a big push right now for more of that type of process, and I think they recognize that it's a very valuable process. Just from my experience with how supportive the ministry was with what we were doing, and that they had a full staff person attending all of the meetings. I also know that on a national level there is becoming more interest in this field. For example, the College of Medicine in the country is now looking at developing some knowledge translation groups as well that Knowledge Translation Platform Malawi would look to collaborate with. So there's definitely interest from different places in the country for sure. And in terms of their ability to produce these briefs, it's something that there's a kind of a variable answer to this. Some are more accustomed to using research evidence than others. Some of the authors we worked with had, never accessed a peer-reviewed article through a database before. So a lot of this was kind of equalized through the workshops that they went through, where they were taught how to use specific criteria to assess evidence and the format of a policy brief and different guidelines to go by, but it's definitely a learning process that was developed along the way, and a lot of times these writing sessions also doubled as ways to build capacity for the communities of practice, for them to learn by going through and practicing writing these briefs. I think the sort of the process of doing this is becoming more common in Malawi for the healthcare sector by using knowledge translation strategies. But it's definitely a valuable. They recognize it's a valuable process, just at least from what I've seen with my time with KTP Malawi. And then the last question about some of the challenges we faced while producing the briefs. I think a lot of it, as you were alluding to, really ties back to the logistics of writing these briefs. Because of the unique way that KTP Malawi decided to produce the briefs by really championing these individuals to build leaders for the healthcare system by helping write these briefs and learning new ways to translate research evidence. It became difficult to, I guess, coordinate in a sense, that there were so many people that their schedules had to match, and to find a date for them to meet was sometimes a challenge. And then, yeah, there were also other things like not having access to some of the journals that we would need to access. A lot of the times we found that the research that we did need was open access. Other times, though, we would have literature that was we would find was kind of buried and difficult to find. And this was actually something interesting that I found, was that we had members of the community of practice team that would know the authors of that research and be able to contact them directly and ask for that evidence, just because they were so they were very aware of the contacts in their field. So that was one of the benefits of having content experts working in an area that they were familiar with.
Thank you. So we have a question from someone online asking about your previous experiences with Dignitas, which you mentioned during your presentation. So did your experience with the Dignitas student chapter help you prepare your work abroad, and if so, how? And in relation to that, what are you bringing back to the student chapter from your internship experience?
Those are great questions. Thank you very much. I think having the experience with Dignitas Youth McMaster gave me more of an investment to want to help the organization, and it really, I think it was a really nice way to learn about the programs that they were doing, because being there on the ground really put it in a different context than what you're seeing. And you're meeting the people working there and the work that they're doing. That was a really valuable experience to me. And I actually learned a lot more about the organization when I was there. And I learned about some of the other programs that they're running. For example, they run these teen clubs, which are for teenagers in Malawi who are positively diagnosed with HIV to come once every or a few times a month to the HIV clinics on the weekend. And it's a place for the youth to meet and to collect their antiretroviral treatments. And I just thought that was a really unique thing that they were doing. And I also learned about like a film project that they were doing, which was an interactive theater sort of piece, a theater for development piece, where they would hold these theater showings, and it was a movie about different experiences, lived experiences of those living with HIV in Malawi, and I thought that was a very unique project that I thought we could actually bring home here and do a showing at McMaster. So that's something that I think we could definitely do, and it's really kind of reinvigorated my interest to spread awareness for the organization here at McMaster.
Great, thank you. Another question from someone online. So first, great presentation. What did you learn about knowledge translation that you didn't know prior to your placement? And what do you think the direct impact of your research will be on the population you studied?
Thank you very much. It's a great question. For your first question, I think what I learned about knowledge translation through my placement was that I think I would have to go back to that it's a skill that you develop over time, and that it's a process that you can become more efficient at as you practice it. So something that it's something that I hope I developed while I was there, and something that I think I also developed while I was working with the McMaster Health Forum through their trainings and learning the methods that they use. So I think that was really the biggest thing that I learned. And for your second question, the impacts. So I think one of the biggest takeaways that I can say to the impact is that hopefully by standardizing the different parameters that they're collecting at an integrated hypertension and HIV clinic, they'll be able to determine what's the best way, what's the right model for Malawi to implement for treating and screening people with hypertension who also have HIV. I think that is definitely something that we're starting to see the impacts of already. It's currently being done. So while I was there in Malawi, we had 4 different organizations collecting, the same data, and they're communicating with each other to be able to figure out what's the right way forward. And I don't think these impacts will be seen now, but I think definitely down the road that these are things that will make a lasting difference.
Thank you, Peter. So I'll open it up again to anybody having any questions. I'll ask one. So I asked a very project-oriented one last time, so I'm going to ask more of a travel question. So you said you moved around in Malawi a lot. You went to the capital quite a bit, and then you did a little, sightseeing and saw the sites during the weekend. So I'm just curious, what's travel around Malawi like? How did you get around? What were the options available to you? And, how did it go?
Thanks, James. So Malawi was a great place to be able to visit, and the different cities there were really, it added a lot to my experience. There's a few different methods you can use to get from place to place. There are minibuses you could take that are usually very, very crowded. I tried to stay away from those. I didn't use those too much. I had some colleagues at work that were very kind and drove me to certain places when there was time on the weekends and things like that. Other times, when it was part of my work to travel to different cities for the writing meetings, we would travel as a group through Dignitas, so that made things easier. And yeah, apart from that, there's nothing much more than those options, because there's not really any official taxi system there. So, yeah.
Thank you very much. And we have another question from someone in the room, so go ahead. So the question in the room, first of all, starting with the logistics issues and planning your schedule around, certain items that might be important to know, like transportation and other types of things that may be important. So did you have flexible scheduling in that regard? Did you have to adapt and think of other things related to it? And then the cycle of the information and how it flowed through. So I'll kind of leave it to you to interpret that.
Thank you for your question. So for tackling the first question, there was definitely a lot of hiccups along the way in terms of scheduling, and when we were setting up meetings, we had people coming in from different places, so we'd set a time, but there's always things that I learned to take everything in stride. So always if you're expecting everybody to be there at a certain time, there could be a lot of reasons why we don't start at that exact time. So that's definitely something that I noticed. Something else as well that was the way that these the funding worked for Dignitas International and other NGOs in general is that things are set aside for specific reasons in terms of funding availability. So whenever we wanted to hold the writing session or anything that was going to require funding, it had to be cleared in advance. And so that sometimes would be a barrier. For example, if we found a scheduled date that was available for everyone, but it was only a week in advance, and that wouldn't allow us enough time to really go through the proper administrative motions to make sure that we could meet then. Okay, so referring to the rapid response cycle, whether it was really a cycle or was it jumping around. So that was a proposed cycle that I had included in the presentation and also in the toolkit that I produced for Dignitas International. It was more of a way to help understand what entails in a rapid response service and generally how the cycle goes eventually ending to the end, but I don't think in practical terms that's how it works out. I think each case is different for sure, and this is a service or initiative that's just starting for KTP Malawi, so hopefully they do see that they can start this rapid response service in the coming year. But until then, we'll have to wait and see.
Great. Thank you very much. So I'm looking again around the room and those online. It looks like everybody is content. I'll pause another second or so, but assuming everybody's good, I want to thank you very much, Peter, for taking the time to present to us the work that you did while you're in Malawi. Peter was our first student we had sent to Malawi, so it sounds like you got a lot out of the experience, and we're glad to hear that the work that you did is having an impact in Malawi and on Dignitas International. So thank you very much for all of that. For those who are joining us online and perhaps later on YouTube, I'm going to draw your attention to some links on the screen. So the first link is if you're interested in our Queen Elizabeth Scholarship Program here at McMaster, that's the link that you can follow to get information. The second link is a link to our QE Scholars Insights page, which lists all of the presentations and webinars that all of our QE Scholars will be doing, as well as links to their bios, links to those webinars, and links to their different individual blogs. And if you want to go right to the blogs, that third link is the link to our blog page where all of our QE Scholars will be writing a blog for all of you to enjoy. So again, thank you everybody for joining us. Thank you, Peter, for your presentation, and we will be back with everybody soon. Thank you.